The claim by some online commentators and instigators that the lack of an exit wound proves Charlie Kirk's assassination was set up is a prominent conspiracy theory that contradicts the official findings and medical explanation. The official explanation for why the high-powered bullet did not exit is based on the principle of terminal ballistics and the specific circumstances of the injury. The weapon used a 3006 Mauser M98 bolt action rifle. Fires a high velocity, high energy round that is typically expected to pass through the body and created an exit wound. But in Charlie's case, report citing the surgeon stated that the bullet's energy was fully dissipated when it struck the body dense structure, specifically the cervical vertebrae, spinal column near C2. The surgeon reportedly Charlie's bone structure as having an exceptional high density. The bullet hitting such a robust, dense bone structure can cause the projectile fragmented, tumble, and rapidly decelerate, lodging its bullet or its fragment within the tissue instead of allowing it to exit. Coroner's finding. The bullet was reportedly found lodged just beneath the skin on the opposite side of the entry wound. While it is rare for a rifle of this caliber, a bullet failing to exit and striking a large dense bone like the spine and sternum is a known, though uncommon, phenomenon in wound ballistics and does not provide definitive proof of a setup. The unusual nature of the outcome is what has fueled the online speculation. Medical literature and case studies confirm that it is possible for a person to be shot in the neck with the bullet striking the cervical spine like C2 and for the projectile to be retained without an exit wound, though it is considered an unusual event, especially with high velocity rifle rounds. While there are no broad statistics specifically tracking the percentage of C2 gunshots wounds that lack an exit wound, the following medical and ballistic facts are relevant. Possibility of retention from bone. These are the mechanism of stopping even high velocity rifle rounds can be stopped if they strike a large, dense, and robust structure at a specific angle. The cervical spine vertebrae C1 to C7 particular the upper segments like C2 is a strong bone complex. When a bullet kinetic energy is fully transferred into the bone, it can cause the projectile to fragmented, deform or tumble, rapidly losing velocity and lodging in the tissue or bone rather than exiting. This is the original explanation provided in Kirk's case. The reported unusual dense bone stopping the bullet. Here is a case study. Medical case reports often highlight retained bullet in the cervical spine. One report highlighted a case of Southern that, after a gunshot wound to the C2 vertebral bone, where the projectile was lodged in the C2 body without direct spinal cord, though the concussive force caused fatal nerve damage. Another case report study describes a facial gunshot injury where the missile was lodged in the lateral aspect of the C2 and C3 vertebrae without an exit wound or neurological, highlighting that bullets can be stopped by that region. Numerous case reports discuss retained bullet fragments in the spinal canal or nearby tissues following penetration. Neck injuries, including the high cervical region C1 to C2, high lethality of cervical gunshot wounds, complex of the neck, gunshot wounds to the neck are among the most serious. Injuries due to the concentration of vital structures like the spinal cord, arteries, jugular veins, and the esophagus, among others. Mortality and complete injury. Cervical, spinal cord, gunshot wounds have a poor prognosis, with report that a high percentage, often 70% or more, of cervical wounds result in complete neurological deficits, paralysis, or are immediate fatal. Bullet caliber and type matters. High velocity difference generally. High velocity rifle rounds like the 30-06 are more likely to exit than low velocity handgun rounds. Therefore, a lack of an exit wound from a high velocity rifle rounds is considered unusual and medically noteworthy, which is why it became a point of discussion in the Kirk case. The specific type of bullet, for example, the full metal jacket, soft point, or expanding hunting round, significantly affect its behavior upon impact. An expanding or fragmented bullet, it's more likely to dump all its energy and stop inside a body than a non-deforming one.